we use the less invasive approaches to make new way for those patients who have been told there's no hope left.
Professor Liao, you've long focused on those tough, complicated tumor cases that other doctors are reluctant to take on. Why is that? And what keeps you going on this harder way?
There is a Chinese saying, a soldier who doesn't want to become a general isn't a good soldier. So I think a doctor's greatest professional fulfillment comes from not only being able to handle what others can handle, but always figuring out a way to treat those really tough, severe cases that others have given up on. That's exactly why I took the lead in setting up the Multidisciplinary Team, named the MDT Team, for Complex Tumor at West China Hospital. The role and the responsibility means my team and I can't only master interventional techniques, we have to build expertise across surgery, international medicine, radiation oncology, targeted therapy, and more, so we can look at the patient from a big picture perspective and figure out if there's still another way ahead. A lot of people ask me what makes interventional medicine so charming. I think it's because we follow official clinical guidelines, but we also dare to go beyond them to explore new possibilities. Guidelines usually lag 5 to 10 years behind cutting-edge real-world clinical practice. What we do is strictly follow the fundamental principles of the guidelines, but at the same time, we use the less invasive approaches to make new way for those patients who have been told there's no hope left. Take our non-trial ablation technology. For example, many of our international peers watched our live procedures and said they couldn't believe it. They said they couldn't put it off themselves. That's the real skill of Chinese doctors using advanced technology to solve tough global problems. Why is that? We treat a lot more patients than medical teams in other nations, and that big volume of clinical cases breeds top-tier operational skills. So I can say in many areas of minimal invasive tumor treatment, Chinese doctors' experiences is truly world-class. We see patients all the time. Surgeons say they cannot cut. Medical oncologists say the drugs are not working. Radiation oncologists say the location is too risky, but when they come to us, we might be able to fix it with just a needle or a catheter. The road is hard, no doubt, but when you see a patient who's been turned away by multiple hospitals, they were told they have no chance, but the patient stand back up and return to normal life because of your skill and your judgment. Wow! That sense of fulfillment is something nothing else in the world can replace.